Hello everyone, I'm Dr. Alejandro Castro and welcome back to our vet board preparation series. Today we'll talk about dexmedetomidine. This medication is a game changer for sedation, but its cardiovascular effects can be tricky. We'll cover some of those in today's video. So let's dive into a case that will illustrate this. A 4-year-old male golden retriever, otherwise healthy with no history of cardiac issues, is presented for a laceration repair under sedation. Dexmedetomidine is administered as part of the premedication at a dose of 250 microgram per square meter, combined with butorphanol IM. Shortly after administration, the dog develops profound bradycardia and hypertension. So which of the following best explains the cardiovascular effects observed in this patient? So before I show you the potential answers, think about the potential effects of dexmedetomidine in the cardiovascular system. If you have no idea, it's okay. Here are the potential answers. A. Peripheral alpha-2 adrenoceptor inhibition, causing vasoconstriction and reflex bradycardia. B. Peripheral alpha-2 adrenoceptor activation, causing vasoconstriction and reflex bradycardia. C. Direct suppression of cardiac contractility, leading to bradycardia and systemic hypertension. And D. Central alpha-2 adrenoceptor activation, leading to decreased sympathetic tone and primary hypotension. Now take a moment to think about the answer. Pause the video and review the answer carefully. Let's break this down. Golden retriever, no history of cardiac issues, dexmedetomidine combined with butorphanol, profound bradycardia, and hypertension. What is the correct answer? The correct answer is B. Peripheral alpha-2 adrenoceptor activation, causing vasoconstriction and reflex bradycardia. So dexmedetomidine is an alpha-2 adrenergic agonist. It's like a key that activates these alpha-2 receptors, primarily in the blood vessels. Agonist means it stimulates the receptor. Initially, it activates peripheral alpha-2 adrenoreceptors. Think of it as a squeeze on the blood vessels. And this is going to lead to vasoconstriction. This leads to a transient increase in blood pressure, hypertension. Now, the body's body receptors, which are like pressure sensors, detect this rise in blood pressure. They say, wow, like blood pressure is up. We need to slow things down. And they trigger a reflex, the vasoreceptor reflex, which results in a decrease in the heart rate, reflex bradycardia. So this initial hypertension is usually transient and rarely a clinical problem in healthy animals. Now, let's look at why the other answers are incorrect. So A, peripheral alpha adrenoceptor inhibition, this is the opposite of what dexmedetomidine does. Dexmedetomidine activates, it doesn't inhibit the alpha-2 receptors. So C, this is incorrect. Dexmedetomidine's primary action isn't on the heart muscle itself, it works through the adrenergic receptors. And D, while central effects do contribute to cardiovascular changes later, the initial response is dominated by peripheral vasoconstriction. So this answer is partially true, but not the best answer because it doesn't explain the initial hypertension. Think of this way, peripheral effects first, then central effects later. So what does this mean for practice? When using dexmedetomidine, always monitor cardiovascular parameter closely. Here is a video from a patient I treated last year showing the dramatic bradycardia and AV block. It was very scary. You can see the bradycardia, 32. It was in 30, between 30 and 40, and even a second degree AV block. And this apparently healthy dog. Thankfully, the patient made it, but this experience made me more cautious about the use of dexmedetomidine. I still use it a lot, but I always monitor the heart rate very closely. So we will not discuss the potential treatment options in this video, but there are online resources that might help you be prepared for this particular scenario and probably give you more information about all the physiological effects and all the potential cardiovascular effects of dexmedetomidine. So thank you for watching. I hope this case helped clarify the cardiovascular effects of dexmedetomidine. Don't forget to subscribe for more board exam preparation material and clinical tips. See you in the next episodes.